Well, hi there, good afternoon and welcome to today's Daily Update. I'm Dougal Saunders and I'm joined today by Assistant Commissioner Jeff McKechnie, who's Commander of the Western Region. And we're here at the Dubbo Regional Theatre and Convention Centre where second doses are happening, the ADF clinic, and you can see a bit of a line-up of people coming in now to receive second doses. So these are the doses that have been booked and received a text message for, and people are turning up, which is great to see. Around the corner, there is also opportunity for first doses, and I'll talk a bit more about that in the next 5 or so minutes. But priority being given to HSC students today, so hopefully you're up out of bed by now. Come on down here, now is the time. If you haven't had an opportunity for a first dose, today is a great way of doing that. So a real focus on 12 years and up, and particularly priority being given to HSC students today, and if there's still some availability tomorrow, that will be available as well. So open till 4 o'clock today for first doses and second doses via booking, and I'll talk more about that a bit later on. But look, some great news today as well with that little ray of sunshine, despite the fact that it's a bit cloudy and a bit drizzly. A little ray of sunshine for people as far as outdoor recreation with the reopening of Burrendong Dam. So that has been confirmed. You do have to be from within the Dubbo Regional Council area to be able to go to the dam. That's part of what the reality is around local governments and movements at the moment. But for the purpose of exercise and recreation, including boating, Burrendong Dam is open as of today. Muckawar will open as of Monday. You can't camp, you can't stay the night. You do need to be doing a day trip, so it's 9 till 5 is the availability. If you do need to get a boat out of a boat shed on site, that's also fine. You just need to ring the park as normal and make that appointment to do that. Now also be aware you do need to present at reception. You need to sign in, all part of a COVID safe plan to make sure that things are being done in the best possible way. Now Jeff will talk a little bit and we'll have a bit of a yarn about how things are working from a policing point of view, but do expect police will be out and about. Police will be checking vehicles, checking boats. It's part of what we need to do to make sure that you're all doing the right thing, but we just want you to be sensible. If you've got the opportunity and you want to, enjoy. Take the opportunity, but do it in the right way. Some things to keep in mind, and there have been a lot of questions that have already come up around this. So your household can travel together in a car. So your family, you can jump in a car and go and do that. But you can't do that if you're not from within the same household. So 2 people can travel in a car, but if you're thinking of using this as an opportunity to be in that group of 5 double vaccinated people in an outdoor gathering, you can, but you can't all travel in the same car. So be sensible about that. Be aware that you can't all travel together if you're not from the same household. You can still do the boating exercise together. You'll still have to wear masks where appropriate. It does have to be done in a COVID-safe way, so please do bear that in mind. Now, up until 8 o'clock last night, 17 new cases of COVID-19 across the Western New South Wales Local Health District. Dubbo has 10, Walgett 2, Warrumbungle Shire Council 2, Burke has 1, Bathurst also has 1, and the Mid-Western Region Council, Mudgee, has 1 case as well. Just want to flag the Narromine case that we mentioned yesterday as possibly being redundant is in fact a false positive, so that has been taken out of the numbers. That Narromine case no longer being counted as a positive case. The health district total is now up to 1,056 and Dubbo at 755. The far west Broken Hill had 4 and Wilcannia had 2. From those 17 new cases, 5 have been infectious in the community for more than 2 days. That includes in Dubbo and in Mudgee. 6 have been isolating and 4 are still being investigated. And 9 of the 17 are definitely linked. 6 are household contacts, includes the 2 at Warrumbungles and the 2 at Walgett. 3 are linked to other cases or clusters and 8 are still being investigated from that perspective. We've got 18 patients in hospital across the district, 4 in intensive care, 3 of those are being ventilated. Over 300 people still being cared for in the COVID Care in the Community program, which continues to do really well. Overnight, another 41 people have been discharged from the program, which is great news, so no longer infectious, no longer requiring any care. That total now over 650 people that have come through the program, which is excellent news. Testing, we've actually had a little bit of a bump, and I'm hoping partly that is because people are very aware of testing being needed, but also with surveillance testing now happening in a lot of parts of our region. So just over 2,900 tests which is around almost 1,000 above where we were just a day ago. So over 1,100 in Dubbo, which is good, back up over the 1,000 mark. Cowra's done great stuff, over 155 on day one of surveillance testing at Cowra. Burke over 80 again. It's been a continuous around that 80 and plus mark, so well done Burke. And Trangie over 200 in the first couple of days of surveillance testing at Trangie. So really great stuff. We want that to continue. So be aware, surveillance testing is available at Dubbo, Bathurst, Mudgee, at Trangie, at Walgett, Lightning Ridge, Cowra, Forbes and also Burke. And with that surveillance testing, what it means is if you don't have any symptoms or any concerns about a close contact of any kind, you can get a test and not have to isolate. You can get a test and continue to work. If you have symptoms, if you have concerns, you do have to isolate. But if not, you can get the test and keep on going. Now, just on percentages of cases, these are of the total cases of COVID we've had. Under 20-year-olds, 28%. Under 50-year-olds make up 83%. And over 70, we've now got 50 people in that total case number above 70. Now, vaccination, as I mentioned, Jeff and I are here today at the clinic at the Dubbo Regional Theatre and Convention Centre. Second dose is happening all day today via the booking, and those additional first dose vaccines are available today. There is availability right now. Okay, so if you are in the Dubbo area and you are looking to get any of your children over 12 done and haven't had the opportunity, today could be the day. There will be probably some availability tomorrow as well, but we're really encouraging over 12s to come here today, and priority is definitely being given to HSC students. We want to make sure you're all vaxxed up and ready to go. So open until 4 o'clock today. Look, some people are saying that they don't have Medicare cards. If you have an individual health identification number, bring that. If not, just bring some ID and you'll be able to get your jab here today. Second dose clinics, I should say, also happening today at Trangie and at Forbes. Narromine's second dose is starting from tomorrow. That's the one. Again, you will have received text message for all these second dose clinics at the Sport and Fitness Centre. There are also opportunities for first doses at Narromine, so be aware of that. For Narromine and Trangie teachers, also for students 12 plus and their families, a great opportunity tomorrow, and additional vaccination opportunities at the Narromine Keeping Place across the weekend, 10 till 5. It's a walk-in one, particularly targeting all of the Aboriginal community. We really want you to be spreading the word around and saying now's the chance to do it. The Narromine Aboriginal Keeping Place is a great opportunity. Mudgee starts from Monday with second doses running for 5 days. Now, the second dosing is happening at St Matthew's. Golgong also starts on Monday, second dosing back at the Memorial Hall. And there's a link on this post to where all of those sites are. So check on that link if you need more details. And there's a big cohort of other towns across the region going into second doses from next week as well. I've mentioned before, West Haven is running its own clinic, a special clinic teaming up with Aspen Medical. So again, targeting people that have possibly missed out, but also targeting people that are living with a disability or disability workers and carers, also people that are homeless or in emergency accommodation. So again, there's a link on this site. Make sure you have a look at that, and if you know people who might need a bit of help and can do that, we're really encouraging you to provide that information for them. Now, just on that, there is a lot of information in this post, and I'll mention it again at the end, but you do need to open the post itself at the very top. So whilst you can watch the video, and this has all the information here as well, to actually get the detail of what I'm talking about, you need to open up the post itself where it says see more. Click on that, the whole post will open up, and there's plenty of information for you there each and every day. On to Wellington, it's been a great success. Second doses have been happening all week. Around 750 second doses have happened, so fantastic news for Wellington. That'll continue again next week, and WAX and Swift Street Medical still providing AstraZeneca, so Wellington really doing well. The Mudgee Vax Clinic is continuing as well this weekend, right now. That special Vax clinic again for school-aged children, so 12 plus, right across this weekend, an opportunity for you to be done at the Mudgee Vax Clinic. You can book on 6362 4031 or via South Mudgee Surgery for more details. And of course, there is that other opportunity through your local GP clinic. You don't necessarily have to be a client. Many of our GP clinics are taking people that aren't clients, and that's continuing. So lots of availability through GPs, also through pharmacies and respiratory clinics and Aboriginal medical services. So please keep checking on that. Now, there's a couple of other things, just very briefly. There's detail of this on the post as well, but a couple of new exemptions around people travelling from a general area through a stay-at-home area to go, for example, to a medical appointment. You won't then need to follow stay-at-home orders anymore when you return back to your general area, as long as you're doing the right thing, as in going straight there, straight home, not lingering, not going into people's homes, that sort of stuff. You can also pick up necessities, including fuel, and all of that detail is on this post as well. So look, great opportunities for people right across the region to continue to do a little bit more than we've been able to, but you do need to continue to do it in the sensible way. I'll leave it now and ask Jeff McKechnie to come forward and say a few words, and he and I will have a bit of a chat about what's going on around the region. Jeff.
Thank you, Dougal. Good afternoon, everyone. It's great to actually be down here at the vaccination site today to see the number of second doses coming through, the number of young people, and that opportunity for people to get a first vaccination as well. So please, Dubbo and surrounding areas, you can travel to get a vaccination. Take the opportunity. Bring your kids over 12. It's just so great that this is available to us. Please get down here and take advantage of it today while we've got it. The work of the ADF, health, we've administered over 34,000 vaccines across my region through this process, and that's a fantastic effort, and we've got to keep that going and make sure we get as many of our people in Western New South Wales vaccinated as we possibly can. When we hit that 80% mark across the state, we want to be well above 80%. We want to be 90%. We want to be 100%. We know we're not going to get that, but please take advantage where you can. There have been some rule changes. You're going to have to be aware that you could well be stopped by police. If you are moving on a road around our region, chances are you will be interacted with by police, and you will need to explain your movements, explain who may be with you as you go about your business. Don't be put off by that, but it's just what we have to do at the moment. People are still moving around against the health orders. Last night here in Dubbo, we issued 11 infringement notices, and we actually had to deal with a number of repeat offenders who really do just struggle to get the message about staying at home and behaving themselves and doing what's right for the rest of the community. Across the region, there are around 60 tins issued, which again is down on recent times, but still way too many. So people need to heed that advice. We're doing a lot of interactions with the community, some fantastic relationship building, delivering wellbeing packages with the ADF. Is seeing us right across the region, interacting with our communities, helping people. A lot of people do want to help, and we're facilitating that through our local emergency management committees. It's been a huge community effort, and we're going to come out the other end of this. Heaps of people vaccinated, lots of people recovered from COVID. Sadly, we have had those deaths along the way, and we want to avoid that at all costs. The way to do that at the moment is to wear your mask, treat everybody like they may have COVID. There's still 200 odd people here in Dubbo with COVID as we speak. Some of those people, believe it or not, are not at home. They might be in the shopping centre, standing right beside you right now. You have to be so careful who you're talking to, who you're dealing with. Wear your mask, maintain the social distancing, use your hygiene, and hopefully we'll all get through. Thanks.
Good stuff. Yeah, thanks, Jeff. Now stay there. Stay
there.
Righto. So just on the wellbeing stuff, we know there was another, I think 20 of the camper vans went out to Bourke during the week, and then 10 to Walgett. How's all that going?
Yeah, the camper vans have been a really great strategy for us just to get some quick accommodation into these locations that where we need to get people out of houses. In Western New South Wales, a lot of our families are big families. They live in big numbers in one house. Now, if you look at the list, as I get every day, and there's so many places, so many addresses with large numbers of people with COVID, so many surnames where they're all the same. One member of the family gets it, it goes through the whole family. So sometimes we have to move people out of that environment who haven't got COVID yet, and these camper vans have proven really effective at Wilcannia, and now we've got this capability at Bourke. We will use it there if we have to, and we'll use it in other locations if we have to as well. Fingers crossed we don't need it, but we're preparing for the worst, and that's proved to be a good strategy.
Good thing to do, prepare for the worst, hope for the best, and we see what happens. Now, I talked about Burrendong Dam as being another one of these little rays of sunshine, despite it being a bit cloudy today. Police will be active on the roads. I mean, police are aware, though, that within the rules, people are allowed to be out and about. But what do you think the approach will be from officers this weekend? Well,
it's about common sense, and it is about protecting the community. As I say, you may well get stopped. If you're on the roads, we've got a much increased highway patrol capability on our roads at present, and they are stopping and checking people's details. You can travel within the LGA, so people from Dubbo can go down to the dam in those family groups, and you can, in public places, have groups of 5 people who are double vaxxed come together, again, maintaining social distancing, wearing your mask, and you have to prove that you're double vaxxed. So if the police ask you for evidence of that, you're going to have to be able to show it. Now, not being able to load the app, not having the piece of paper is not going to cut it. If you can't show you're double vaxxed, there's a fair chance you're going to get a ticket. So please, do some pre-planning. Make sure everyone that's going has got the certificate, has got evidence of double vax.
Yeah.
And you can show you're all from the one household. Otherwise, you're just putting yourself out there. So we don't want to discourage it. We want people to get out and about. That mental health aspect really is coming to the fore. It's been a long time. We are seeing movement. We collect a lot of data, and we are seeing movement across the region creep up. The graph's just slowly trending up, which is not good. We need to be vigilant for a little while yet to make sure we get through this as well as we can.
Part of the message, I guess, is that if you really feel like you need to get out, you need to spend some time with the family outside, great. If you don't need to travel, and if you don't really want to, well, it's not a necessity that you go to the dam. You don't have to go to the park. If you really want to and need to, it's an option there for you in the most sensible possible way you can.
Yeah, absolutely. Common sense is the thing, because, as I say, there's still a lot of COVID out there. Even if you're vaccinated, I mean, you can still get COVID, and you can still transfer that to someone who isn't vaccinated. So it's just about being very, very careful at the moment, and we need everybody to look after themselves and make sure when we do hit that 80% mark, as many people as possible from Western New South Wales, in particular Dubbo. I mean, we're all from Dubbo, please. Dubbo, come on. Get down, get vaccinated, take advantage of what's on offer, and make sure we get as many of our folks through this as we can.
Beautiful. Thanks, Jeff. And look, that pretty much wraps it up today. Some pretty common sense words from our Western Region Police Commander. So the opportunities are there in small ways to try and say, you know, you can do a few more things than maybe you were able to previously. You still do need to follow orders. You still do need to have a mask. If you're with a group, you still have to be able to prove you're double vaccinated. So do the right thing. If you're out and about, enjoy it, take advantage of it, but do it in a sensible way. As Jeff mentioned again, lots of opportunity here today. Second dose is happening, but that first dose clinic again, priority for HSC students today, and also some availability tomorrow. Have a fantastic Saturday. Catch you again tomorrow at midday.